If 5.4 million deaths from COVID-19 is a staggering figure, then how can the true number be described? The World Health Organization thinks the total toll was nearly 14.9 million at the end of last year. The WHO reached this conclusion partly by looking at deaths indirectly related to the pandemic. For example, people who couldn't access overwhelmed healthcare facilities, as well as countries where the true number wasn't reported. Almost half the unreported deaths are thought to have taken place in India, where an estimated 4.7 million people died in May and June last year alone. But the Indian government insists its death toll for January 2020 to December 2021 is 480,000. And if the worst of the pandemic is over, the WHO warns the picture remains complex.
Globally, reported cases and deaths from COVID-19 are continuing to decline, with reported weekly deaths at their lowest since March 2020. But these trends, while welcome, don't tell the full story. Driven by Omicron subvariants, we're seeing an increase in reported cases in Americas and Africa. The South African scientists who identified Omicron late last year have now reported two more Omicron subvariants, BA4 and BA5, as the reason for a spike in cases in South Africa. It's too soon to know whether these new subvariants can cause more severe disease than other Omicron subvariants.
The US is now at about 1 million deaths, according to Johns Hopkins University. And as the Omicron subvariant drives up cases in New York State, one of the most populous in the US, mask wearing continues to be a flashpoint. The Centers for Disease Control and Prevention restating its recommendation that travellers wear them on public transportation, despite a court ruling last month that struck down a mandate. Owen Fairclough, CGTN, Washington.